Okay, so today we're going to talk about introduction to telehealth and telemental health. My name is Dr. Kimberly Mincy. I am a clinical assistant professor at Texas A&M University Corpus Christi, and I am also the clinic director of the Counseling and Training Clinic. So one of the reasons why I am providing this presentation is kind of because of the global pandemic we're currently under and how we have transitioned our clinic on the TAMU-CC campus to a telehealth clinic for the time being. And so I wanted to cover information very briefly and very broadly about telehealth, telemental health, and how we as supervisors and practitioners at integrative care facilities can provide services when we are not providing services face-to-face. So we have a bit of an agenda today. First, we're going to talk about telehealth and telemental health. We'll talk about the need for telemental health, the level of acceptance of telemental health, and supervisory practice using telehealth services, some strengths and limitations. We'll review ethical considerations along the way, and we'll also talk about things that we can do in the future. So, an overview of telemental health. So, first things first, there's a lot of terminology that is thrown out in literature and in the media about what telehealth is. So for terminology, we first need to look at what mental health professionals look like when it comes to telehealth and telemental health. So when we're thinking of mental health professionals, that can be providers, it can be counselors, psychologists, social workers, marriage and family therapists, nurse practitioners, physicians, nurses, psychiatrists, and even physician's assistants. With telehealth, there's really no standardization. So you can see literature dictating that telehealth is telehealth, as well as telemedicine, telepsychology, telepsychiatry, telemental health, telecounseling, e-therapy, e-counseling, distance therapy, and internet therapy. And because of all of these varied definitions, varied terminology or terminologies, we also have quite a few different varied definitions of what telehealth and telemental health can be. So for example, Perdina and Allen in 1995 suggested that telehealth was the use of telecommunication technologies, so the phone, video conferencing, and the internet, to deliver healthcare practices. On the other hand, the U.S. Department of Health and Human Services suggests that telehealth is the use of electronic information and telecommunication technologies to support long-distance clinical healthcare, patient and professional health-related education, or public health and health administration. And in addition to that, there is another definition that suggests that telehealth is just a collection of means or methods for enhancing healthcare, public health, and health education delivery and support using telecommunications technology, usually including the following four domains: store and forward, asynchronous services, remote patient monitoring. So remote patient monitoring is kind of like what your fitness trackers are, or if you were serving a client who is taking data for their doctor while they were at home, so maybe blood pressure or diabetes testing. Mobile health or live video conferencing, synchronous. Distance therapy is also defined as a form of telemental health, and so that's the use of technology to meet therapeutic needs of clients in a location different from the mental health professional, either synchronously or asynchronously. So when we're thinking of telehealth, synchronously is a live practice. So something like a Zoom call, or if you're using an EMR that has video conferencing within it, that would be a synchronous meeting. You're doing it in real time. So some video conferencing services also have the opportunity to record information. So like this is a recording, so you are going to be getting it asynchronously. We are not going to be meeting in real time. With all of this information in mind, it can be helpful for us to conceptualize the usefulness, appropriateness, and the need for individuals using telehealth services with basic statistics regarding internet usage and accessibility. And so really, again, overview of telehealth is that it's happening online, and it is the use of either the phone or the internet. And so that's kind of why these stats can be helpful for us, because we're looking at individuals who may or may not be at a moderate or low SES or a high level of SES, as well as different age ranges, different education levels in different areas of the country. So in comparison to 2000 and 2019, individuals with an income under $30,000 annually, we started at 34% in 2000, and in 2019, 82% of individuals with income under $30,000 annually are using the internet. Users over the age of 65 was 14% in 2000, and it is 73% in 2019. Percentage of users who do not have a high school education. In 2000 it was 19%, and in 2019 it was 71%. For college graduates, 2000 it was 78%, and in 2019 it was 98%. And then finally, another use and appropriate mean of providing teletherapy services includes the use of cell phones. So between the ages of 18 and 40 years old, 99% of individuals use a cell phone, and 96% of those individuals use a smartphone, so with video conferencing capabilities. Between 50 and 64 years of age, 95% of individuals use cell phones, while 79% use smartphones, and 65 plus, 91% use cell phones, while 53% use smartphones. More or less, these statistics suggest that individuals with higher incomes and higher levels of education have a higher level of use of the internet or of technology that meets a higher level of birth or need within our current age of technology. So let's discuss a little bit about the need for telehealth and telemental health in general. So we know that there are high percentages of access and use of the internet across age groups, and a moderate spread of usage across levels of SES. With this in mind, we need to really think about the level of appropriateness for telemental health supervision as we are serving CITs and serving facilities that provide integrative services across the coastal bend. So in general, for counseling services and location, we really have to be cognizant of this inability to provide appropriate services in rural areas. So currently there's a shortage of mental health providers in rural areas. So for example, 1/3 of those who live in rural populations in the US lack any access to psychologists, and more than 1/3 lack access to any specialized mental health services, period. Due to the scarcity of mental health services in these areas, there are really limited opportunities for collaboration and consultation between clinicians and supervisors, and that includes CITs and student counselors in training. There's also limited instances of referrals or supportive services between mental health professionals, so facilities have a decreased ability to connect and communicate and collaborate with each other, and integrative care facilities and the services rendered are also minimal in populations where there is not a large populace. When clients and clinicians are having to commute to these locations, there's an expectation that there can be some type of impact on financial well-being, whether that is to the clinician, to the supervisor, to the CIT, or to the individual seeking services. So ultimately what we're looking at is if a counselor or a supervisor is commuting for really long durations of time, there's less time to spend with their clients, and there's a lot of consequences that happen. So there's the added expectation of exhaustion, burnout, there can be low morale, there can be a reduced appreciation for serving the area or the population that's being served, reduced job satisfaction. There can be a lot of impact that can be quite unhelpful for serving the community that we may or may not be serving. And then when we look at supervision of supervisees or of our CITs at different facilities in different areas, CITs can often feel overwhelmed without proper supervision and without an established support system. So at facilities, usually there is more than one CIT being served. If they're not able to collaborate or communicate effectively with their peers, there could be a sense of isolation or disregard that they can experience, as well as having an experience of lack of supervisory alliance or lack of connection with their supervisor. CITs can perform at a lower level and experience higher inadequacies or deficiencies as a result. They can also experience ethical dilemmas and not follow through with appropriate protocols if they're not being appropriately supervised. CITs can also experience burnout, like I mentioned earlier, and their well-being can be impaired. So if we have an individual who's not only burned out, they're exhausting their means, they're not being appropriately supervised, there's a lot of stuff that can happen, and stuff being ethical dilemmas, loss of confidentiality, malpractice, legal issues, so on and so forth. And this is all really appropriate and true for the current pandemic that we're all experiencing. If CITs are providing telehealth services because they are needed without appropriate supervision, this can lead to a host of deleterious consequences for the health of the profession, for clients being served, and for the CIT's overall growth and development into the field. So this is really just signifying this need for telehealth services, and in addition to the need that we as supervisors and individuals at integrative care facilities need to provide to those who are choosing to participate with the clients that we are serving. So even though there are significant limitations, so like for example, that can be a reduction in ability to see nonverbals or visual cues. Supervisors and CITs can experience an increased emphasis on communication and creativity when developing the therapeutic relationship and or a supervisory relationship. And so this is really leading us into this idea of not only do we need telehealth and telemental health, but we have this overall idea of need for acceptance and how we can accept and promote the appropriateness and the efficacy of telemental health within our profession. So there are researchers such as Reese et al. Who have discussed how efficient and affordable telehealth services can be and how they're a viable option for clinical services, as well as to offer training and provide professional support. So we can use supervision, we can provide theory training, we can do training such as the one that you're listening to right now. We can offer consultation, education to professionals, to our CITs, to individuals in the field, education classes, integrative services, case management, the list can really go on. So currently at the CIT, we're offering integrative services in collaboration with the College of Nursing and Health Sciences on campus, where our nursing students and our CITs are providing telehealth services simultaneously, where they are collaborating on the care of the clients that are receiving services at the counseling and training clinic. So they are working as a team to assess and evaluate the physiological and the mental health of an individual when they come in. So when we're looking at telemental health, we can see how it can help people receive services they normally could not, attain services they normally would in case of any extenuating life circumstances. So receiving services they normally could not if there was a lack of health care or insurance. We're providing the opportunity for our clients to be able to see nursing students so they can have some free medical care and medical resources that they might not normally receive. And then for our clients at the CTC, we are providing telehealth services so they can continue attaining the services that they normally would receive if we were not currently in a pandemic. In addition to life circumstances, if we adopt our practice to provide telehealth information or services. We can help our clients who maybe are bedridden because they had a surgery, or maybe they just brought home a new child. Their job status changes. They're full-time employees who regularly work during regular business hours, or they can receive access to services that they would just not be able to. So maybe groups, or if parents have a lack of childcare. In general, telehealth can provide this opportunity for therapy to be made easier and more accessible, easier to gain and more accessible. And this is all when we're looking at if teletherapy is provided correctly. So when it is provided correctly, telehealth can strengthen the therapeutic relationship. It can allow for more engagement with the therapeutic process, which can improve outcomes and reduce feelings of isolation. However, if it's poorly delivered, so if we're not providing the appropriate resources or effective resources or appropriate therapy or effective or best practices, our clients can feel disengaged, they can become isolated, and experience a lack of motivation. And we'll discuss some of those limitations and more strengths later on in the presentation. So when we're thinking of telesupervision, we've kind of already talked about all of these definitions. I've given you a lot of overview of different just ideas or concepts within telemental health or telehealth practice in general. So we have all these definitions. We know a few stats. I've listed a few ways telehealth is helpful in daily practice. So now it's time to really consider what this means for clinicians, what this means for those of us who are providing consistent integrative care, and what it really means for supervisors. So on this slide, I have a list of a lot of different questions that we have to consider when we're providing services to our CITs, and what we should look for when we are providing professional practice and helping them develop in appropriate ways. This is not an exhaustive list. This is just a few quick little ideas, and I really want to discuss the impact of these questions on how we can move forward with providing appropriate teletherapy, telehealth therapy, and telemental health therapy. So first and foremost, we as supervisors have an obligation to ensure that we are competent in what we are doing. There are multiple avenues for us to become board certified telemental health providers, so ABCT, MHP. This is not required by all states. However, some states require a specific number of CEUs to be able and applicable to provide telehealth services. One of the big emphases that Texas has is that care services should be similar whether they are face-to-face or provided via telemental health means. So best practices have to be applied, empirical practice has to be provided, laws and ethics need to be maintained and followed. So regardless, we have to practice within our standards of care, and we have to continuously practice with best practices in mind. And that is what we are needing to help develop our CITs to be able to do as they continue growing and developing. So not only do we have to make sure that we are competent in our practice, we have to train our CITs to fulfill the same regulations. So for example, some interventions may be beyond the authorized practice of mental health professionals in some locations. So I read a study fairly recently that while a lot of EMDR trainings are provided via telehealth or via teletraining, it might not necessarily be the most appropriate for our clients to learn. However, that doesn't mean that it can't happen as long as we're providing the most appropriate care possible to our clients. As licensed professionals, it's our responsibility to ensure the scope of practice that our CITs are engaging in. So we have to ensure that all activities that are being provided are defined in law and not above the boundaries of practice, in accordance with and in compliance with our professional standards. So really looking at the legality of what we're doing and our ethical codes. So we have this obligation to ensure our CATs understand confidentiality and that they understand privacy when it comes to working in a telemental health setting. So in addition to all of this, all CITs, all clinicians, all providers, and staff members have to be trained and aware of all policies and procedures. Even though a lot of these policies and procedures are being adapted every day, they're being changed to meet the needs of things that we have not been able to anticipate that are ongoing. So if you are working with an integrative team, something to consider is how files will be transferred or discussed between members. So if a physician, a dietitian, a caseworker, a CIT, and a supervisor are all working together, but there is only one physical copy, how is information going to be dispersed? If there is a electronic copy, so if your facility has the capability of using electronic medical records, does the CIT have access to that? Does the supervisor, does the dietitian? Is there a way to access that information appropriately? How is new content added to the case file? So on and so forth. If there is not access in your facility or within your practice to have electronic medical records or electronic health records, how are you going about maintaining confidentiality and privacy of all of your clients? How about your supervisees and your staff members? There are a lot of ethical errors that we can contribute in if we are not looking at all of the considerations of every event and every activity and protocol that we are abiding by and setting forth. So we need to make sure that all of our CATs are aware of policies, how to follow them, and we need to keep them updated if policies changes. If policies change. We have to be aware of the procedures and what we must do when an ethical dilemma has occurred and how to utilize. We need to help them determine how to utilize their ethical decision-making model. So if we are looking at our students and our CATs and how they're developing, we have to make sure that not only do they understand the steps to take, but we have to help them develop their critical thinking skills and the processes and procedures that they need to follow to ensure that they are practicing appropriately. We also have to have our CATs be aware of how confidentiality and privacy is being maintained when working with clients and when seeking supervision. So this really may be dependent on whatever facility or practice you are participating at, because procedures could have slight modifications depending on resources, or there could be really significant modifications due to resources or the equipment or technology that is available to each student, to each supervisor, to each staff member, or within the facility itself. We also have to understand, or we have to have our CITs understand the processes and procedures if there is a compromise to privacy and security, either of their content, of their clients' content, or any of the content or data stored at the facility. So that includes where content is stored, so where case files are stored. So where case files are stored, where treatment plans are stored, intake data, if there's use of assessments at your facility, where that stuff is maintained. That could be through the use of a cloud, a physical server, an electronic or internet-based server, external hard drives, USB drives, web pages, or even through electronic medical records or electronic health records. Our CATs need to demonstrate an awareness over all policies and procedures regarding risk assessment and emergency management when they are not at the facility rendering services. So when they are providing telehealth services, they need to know what their emergency management or emergency protocols are if their client is not physically with them. So when we all have these protocols and like just in general when we're working with clients face-to-face at our facilities, when either a client or a CAT is unsafe. And so we have to really look at, when we're providing these services virtually, what that looks like. And we have to navigate how our facilities choose to run these protocols and determine how CATs and other professionals within your practice will be trained. Our CATs are also expected to demonstrate an awareness over note-taking procedures. So how are your clients going to get the data that they need? How are they going to store it? Are they using their personal phones? Are they using their personal voicemails? Is your facility an emergency clinic? If they are taking notes, how are they destroying that information? So on and so forth. So we really also need to consider a multitude of other things. So, for example, what if a client calls one of your CATs when they are in transit, or if they are with a friend or a family member? What if a client is engaging in an appointment but their internet connection is unstable, so they suggest an alternative means like using FaceTime? During a session, a CAT, as another example, might discover that their minor client has a parent who has been unknowingly sitting in all of their sessions, and what they would do with a dilemma such as that. Maybe a client requests a family member or a friend to just join in on their next session. We need to help our CATs navigate what to do if our client is in imminent harm, but we do not have the contact information or an address of where a client is. Maybe a client discovers sessions with a minor were done without a guardian at their residence. And we also have to have an understanding of how data will be transmitted to and from a client. So if a client is completing an informed consent, if a client is providing intake information or results of an assessment. So we really have to take into consideration the resources that are at your disposal and HIPAA compliance, legal mandates of the state of Texas, and all of the various code of ethics that we must abide by. So we also, I know that this is exhaustive, so I really apologize. I just wanted to be as detailed while being as concise as possible, and I know that that is contradictory. So we also have to consider about where our students are providing their services. So when they're setting up their room, are they in a quiet, confidential, and secure place? Do they have stable internet? If they are using video services, what is in their visible area to their client? Are they ensuring that they are checking their audio and visual connectivity and making sure that it's stable? We have to ensure that there are multiple ways for our CATs to contact us in case of an emergency. So only having like a phone line might not be sufficient. We might want multiple phone lines, office lines, a use of a chat program, so on and so forth. Prior to sessions, we need to make sure that documentation is maintained appropriately and how the students will get that information and what obligations and tasks are going to be put on the supervisor to ensure that our CATs are getting that, because there's a lot of admin work that really gets placed onto the supervisor's shoulders in some of these instances or in some of these scenarios. For managing client expectations, we have to help our students figure out how to establish appropriate boundaries, how to establish and assess appropriate needs and concerns of clients, document all of the communication that they experience, create and follow policies and procedures, and be adaptable and flexible when procedures and policies change. Paint a realistic picture of the results they can expect, and make sure that they're providing collaboration. One thing that we've implemented at the CTC and research shows has been helpful is establishing checklists for each session. So making sure where clients are when they are during session, every session, where they are, during every session. Ask if they're by themselves or if they're in a safe location. Ask if anyone can hear their conversations. Determine if there is background noise and how we can eliminate any distractions that can impede service. Review emergency information to see if there's changes that need to be made, and discuss any procedures if services are interrupted, and how contact will be reestablished. So there's a lot of information that we have to do as supervisees in terms of telehealth therapy, especially when there's not a specific program like an electronic management system being used. So when we're looking at managing a supervisee relationship, we also have to help ensure that our supervisees' expectations are as realistic as they are helping their clients expect. So for example, if your CATs are contacting you every couple of seconds, is that realistic for them to expect? How can we help them develop independence? How can we help them establish what the appropriate policies and procedures are, and how to maintain that knowledge and retain that knowledge, and how they go about navigating any ethical dilemmas that they might be experiencing. So earlier, when I was going through all of that wonderful content, I was really talking about how a lot of burden can be placed on the supervisor to ensure that our CATs are getting all of the information appropriately and making sure that they are following any policies and procedures. More specifically, looking at the administrative part of telehealth, if there is not equipment such as an EMR platform. So platforms can be used to provide data storage, such as your intakes, your informed consents, your session notes and treatment plans. You have to make sure that all of the platforms, or a platform that you choose, is HIPAA compliant in all three ways, and there's a large conversation on how it's meeting all areas of HIPAA compliance, and the conversations that you have to have with the individuals that are providing you the software. I have a list of platforms on this slide. They all have different pros and cons. Some of them have video services, some of them don't. Some of them you pay monthly, some of them have free trials, some of them you pay annually, so on and so forth. So these are the ones that a lot of individuals currently are using in the world of COVID-19 that we're experiencing, and they have been quite helpful. However, not all of us have the opportunity to have an electronic management system. So for example, at the CTC, we are working to attain funding for an EMR, but in the meantime, we're collaborating with the university to use WebEx, and all of our data is being stored on our local servers because they're audited and secure. We are using a research software, Qualtrics, for data collection, where all of our notes and treatment plans are being stored, and I'm basically the person that has access to all of that. So I'm having to collaborate and work with my students, or excuse me, my CATs really regularly to make sure that they're having the data that they need when they need it, and that they are disposing or closing out of that content as it is appropriate. And for communication, we're using Microsoft Teams, our phones, and a help function within WebEx to have constant and consistent communication. And we're making sure that we're keeping all confidential and private information out of any of these programs when we're discussing our clients. So there's a lot of ways that you can make what you have accessible to you, adaptable to the services that you're working with, as long as you're ensuring that confidentiality and privacy is being maintained. For efficacy of supervision via telemental health, researchers have really indicated that CATs have rated their satisfaction with telehealth in person as a comparable experience to receiving supervision via telehealth. So for example, the supervisor relationship was not impacted, needs of the CATs were met, and telehealth supervision was determined to be a viable source of supervision for their growth and development. CATs also indicated that they had an increased experience of self-efficacies, increased insight, increased ability to perceive cues, embedded in verbalizations, increased their dexterity in comprehending chaotic feelings and thoughts. So overall, several studies have indicated that there has been usefulness within providing telehealth supervision. However, there has to be the collaboration and the consistency between both or all supervisors and supervisees. So intentional engagement versus just showing up. There are quite a few strengths when we're looking at what telehealth can provide to our CITs, to supervision, and to our community of clients. So when we're thinking of our clients, telehealth has been shown to be helpful in treating individual, couples, families, and groups, especially when we're looking at individuals with anxiety, depression, general anxiety disorder, post-traumatic stress disorder, and panic disorders. It's also been demonstrated to be effective for those with substance use disorders. Telehealth is also really helpful for those of different ability levels, and it can be adapted to meet the needs of our clients that have different ability levels. It creates opportunities for clients to find professionals who are competent to the culture that they have grown up in or that they follow, as well as understanding their ethnicity or their race. And telehealth services allow our clients and our CITs, as well as us, to reduce stigma within the mental health profession. There are a lot of additional benefits, such as client appreciation for the affordability of services and access to services that they might not have had access to previously. There's a reduced experience of discomfort or fear when talking about intense experiences with a counselor. So we've had quite a few anecdotal pieces of evidence of clients opening up with things that they have never addressed before in session since we have gone through telehealth. And that has been really neat to experience and see. There's also a reduced risk of difficult emotions being felt. Clients have suggested it is a safer experience for them to have these really intense emotions because there are reduced reactions or judgments, either intentionally or unintentionally, by CITs when these intense experiences are being had. There is this idea of an easier access to services. So time is being saved instead of having to drive significant distances. We can provide quality treatment quicker. Technology advances make it easier and more affordable to implement a variety of high quality telehealth solutions. So going back to the statistics from earlier, a majority of individuals from the ages of 18 to 40 have smartphones, and quite a high percentage of individuals that are older than the age of 40 also have smartphones, where telehealth services can be rendered quite easily. And again, going back to what I said earlier, telehealth is comparable to in-person services if the services are provided appropriately. And finally, telehealth, well, actually it's not necessarily finally, but the final thing that I'm going to address is that telehealth helps to decrease the risk of individuals with different disorders of being impacted by going to facilities where they will be exposed to quite a few people. So individuals who might be receiving cancer treatment, or those with autoimmune disorders, any individual who is immunosuppressed might be at risk if they are going to wait in a waiting room or if they are seeking inpatient services. They may or may not be at risk depending on the healthcare standards wherever they are at. And so if we're providing telehealth services, we can offer care to clients who may or may not have been in jeopardy of seeking services where they might be face-to-face to quite a few different people. And for limitations, clients can seek services wherever they want. So clients can be on the bus, or they can be driving with their friends in their cars. One of the platforms that was on the list earlier, BetterHelp, has ads where they show clients seeking services on the subway, or while they are on their lunch breaks in their office, as they're cleaning, running errands, going to doctor's appointments, so on and so forth. So there are a lot of different ethical dilemmas that can happen, as well as lack of intentional engagement in session. There are quite a few life coaches that are already rendering telecommunication services. So life coaches don't have to be licensed, and they set themselves up to get calls and texts whenever they want to. And so these practices can hinder professional mental health services because life coaches can relatively do things that may or may not be the most ethical when we're thinking from a counselor or a supervisory perspective. Also, a limitation is a budget. So if we're working at facilities or private practices, we might have limited funds for providing things such as updated technology, software, getting IT support, servers, websites, storage, even buying an EMR. All of those things can be relatively costly, and they add up relatively quickly. Another limitation is that we have clients who may or may not have access to technology, whether they don't have consistent or stable internet, whether they are in a location where internet connection is not easily gleaned, so on and so forth, as well as individuals of low SES may or may not have the resources to access technology consistently. And then finally, there are a few telehealth-based models of supervision, so there's low empirical research, and there are instances of ineffective relationships being developed when we're working from telehealth, so the therapeutic alliance might be hindered as well as the supervisory alliance. It also might be hindered. For future directions, things that we need to know or explore is how technology can enhance professional practice, what we need to do to understand security risk and steps to minimize risks, recognize risks to privacy, confidentiality, and informed consent issues, and implement a slew of different plans to reduce any risk. And we also need to be aware of ethical challenges that exist when using tech, as well as demonstrate adaptability for our clients of different ability levels. So I really want to extend my thanks for listening to this. And if you have any questions or concerns, please feel free to reach out so we can have a discussion. You can reach me at my email address, which is kimberly.nancy@tamu-cc.edu, or you can call my office at 361-825-3995, and I will be happy to continue this discussion. Again, thank you so much, and have a wonderful day.